Untold stories. The nurse who disappeared. It was an ordinary night at the hospital. The hallways were softly lit, with the sound of footsteps, alarms, and the usual hospital routine. But something was about to happen that no one could expect. A young nurse, looking worried, was in the hospital's break room. She was reading some notes on a piece of paper, and when she looked at the clock, she saw that it was almost 11:45 p.m. She quickly stood up and hurried through the hallways. She was focused on something important, something only she knew was about to happen. As she walked, the sound of sirens filled the air. An ambulance arrived fast. The nurse ran to the entrance where a team was waiting. Inside the ambulance, a pregnant woman in labor arrived in critical condition. The atmosphere quickly became frantic, but the nurse stayed calm. She was the only one who seemed to know what to do, moving fast and precisely. While the doctors seemed confused, the nurse began working without hesitation, starting the necessary treatment. What looked like a hopeless situation, she handled with calm. Soon, though, more critical patients started to arrive. Many others came to the emergency room with signs of a strange and deadly illness. Chaos took over the hospital. More beds were filling fast, and the doctors began to panic. In one of the hallways, the nurse realized that things were getting out of control. The illness seemed to spread quickly, and no one knew how to stop it. But the young nurse noticed something that no one else did. She made a bold decision. Without asking for permission, she organized the team and started an experimental treatment that no one thought was possible. It was risky, but she had no choice. Time was running out. As the hours passed, her actions began to show results. Some patients started getting better, but the work wasn't over. She moved from patient to patient, working non-stop. Even when she was exhausted, she didn't stop. But there were still so many sick people, and the pressure was rising. After a few more hours, the nurse felt that the situation was not completely under control, but she knew something was about to change. When she felt the situation was calmer, she wrote down important instructions on a piece of paper and handed it to one of the doctors. Then, she quietly left the room without saying a word. The next morning, the hospital was quiet. The chaos of the night was over, and those who had been treated started to recover. The doctors gathered, relieved, but still not sure what had happened. No one could explain it. All they knew was that something amazing had happened, but no one understood how. The nurse, however, had disappeared. She left the hospital during the night, leaving no trace behind. No one knew where she went or what happened to her. In a city where many people were recovering, no one knew who had made the difference. When the stories about that night spread, no one mentioned the nurse's name. Her actions stayed secret and her sacrifices were unknown. The next week, a report about the recovery was posted in the hospital. Thousands of lives had been saved, but the nurse was never recognized. Her name wasn't anywhere. The doctors and nurses were grateful, but no one knew who had really made the difference. As time passed, the hospital went back to normal. But the story of that night was never told, and the nurse's name disappeared. What stayed was a silent feeling of gratitude, as if an invisible force had saved the city. And maybe that was exactly what she wanted. A story with no face, no recognition, but an impact that would never be forgotten, even if no one knew who the true hero was.